Markets if that's okay.
Can I have one of those?
Go for it.
Okay, go. Hi everybody, thanks for coming. Should I first mention about staffing? Why not?
That's more part of staffing.
Do this first? So we're going to do some CE and we're being taped, and I guess this is going to be on YouTube. Hi everybody, we're going to be famous. So the lecture this week is on corticosteroids. We use steroids all the time, and let's have some knowledge on steroids. There's many kinds of steroids. So some general information on steroids. When you mention steroids to people, they often think androgenic steroids. That's not what we use at VetVision. In fact, those drugs are hardly ever used in any scenario, and usually they're used illegally. The steroids that we use are called corticosteroids. We usually shorten it to steroid, and we use them all the time, obviously. And what they do is they suppress inflammation, plain and simple. That's what they do, very generally, very indiscriminately, and that's what we use them for. So what are the lists of things that we use steroids for in general? As I said, these drugs suppress all types of inflammation in a very general way. Any part of the body, depending on how you give it and the dose. There's many different ways to administer cortisone. For us, it's mostly topically in the form of eye drops. But topically also means on the skin. It can be inhaled for those of us with asthma, and it can be used oral or injectably, in other words, systemically, for systemic inflammation or specific types of inflammation that are particularly bad. The effects and side effects are dose dependent, meaning the more you give, the more anti-inflammatory effect you get, and also the more potential for side effects, and that's the way it is with most drugs. High systemic doses will cause immunosuppression, meaning your immune system gets depressed and you can't fight off infection quite as well, and that can be good or bad. Usually in our field, in veterinary ophthalmology, we want to avoid generalized immunosuppression, but an animal, for example, with lymphoma or lupus, that's what they're shooting for when giving these drugs. So it's kind of a fine line between treatment and side effect. Sometimes people think that they're painkillers, and they're absolutely not. They're anti-inflammatory, which might ease pain, but they're not painkillers. So keep that in mind when talking to owners. Painkillers are NSAIDs and opiates. NSAIDs are analgesic and anti-inflammatory. That's worth knowing. Opiates are analgesic, but not at all anti-inflammatory. Here's some pictures of dogs that we don't see in our clinic. This is a dog with hives. It's a little bit difficult to see, but that's a systemic allergic reaction, and one of the drugs used to treat it with is cortisone. This is a dog who is stung in the face by a bee and is close to having an anaphylactic reaction, and one of the drugs you give is IV steroids. Here's a dog with flea allergy dermatitis. In the old days, before there was, I don't know what drugs they are that you put on dogs that make fleas go away, we'd see this all the time. And what do you do to make the red go away? Give them a shot of cortisone. It doesn't cure anything, but it takes away the inflammation that's causing these signs. Now, in our field specifically, in veterinary ophthalmology, as I mentioned, the topical route is by far what we use most commonly. Eye drops and ointment for conjunctivitis, which is usually allergy or due to irritants. This is really common. Keratitis, which is often immune-mediated. What's the difference between immune-mediated and allergic? Not much. It's kind of an academic difference between the two. In fact, you can kind of think of allergy as a minor manifestation of an immune-mediated disease. KCS, there's always inflammation, and so we're going to want an anti-inflammatory of some kind. And then, obviously, after cataract surgery or any other intraocular surgery, because when we do that surgery, we cause inflammation, and we want it, obviously, to go away. Our bread and butter products, as you know, are predacetate and neopolydex. Predacetate only has steroid, the neopolydex has antibiotics as well. That's worth knowing. When do we choose drop versus ointment? I mean, it's a short story. The ointments last longer, and the drops are easier for clients to give. That's really, the parameters that we deal with. You're familiar with giving a subconjunctival injection. We can give virtually any drug subconjunctively, and in this case, we use triamcinolone, and it will last in the eyeball for about 5 to 7 days. Why is that a good deal? Because it only treats the eye. It hardly treats the system at all. It mostly stays in the eye, which is what we want. For systemic use, we do use that in veterinary ophthalmology, but not as commonly, and we'll use that in more severe inflammatory conditions. Here they are, our favorite drugs, Neopolydex and Predacetate. Just kind of the short story is the Neopolydex obviously contains antibiotics. It's better for eyes with purulent discharge. However, the antibiotics, remember there's two of them, there's neomycin and polymyxin. They are sometimes known to be irritating to the eye. Every now and again, we'll give someone Neopolydex and they'll say, well, it kind of irritates them and this and that and the other. It's probably the neomycin or polymyxin. The folks at Davis did a study on kitty cats and found that polymyxin in particular can be irritating to cats. That doesn't mean we don't use the drug, it just means we have to be thoughtful about it. Prednisolone is generally stronger than Neopolydex, and one side effect, which we'll talk about in a minute, is that it might make corneal mineralization worse. So these are the things that we think about when we're choosing one drug versus another. This is an example of a subconjunctival injection. It occurs to me that almost everybody here is an RVT, and so you've probably seen all this stuff already, but if you notice, there's the bleb underneath the conjunctiva, and again, you can give any kind of drug subconjunctively, and in this case, we're talking about steroids. So here's a quiz for you guys. Here's a red gross eye, and I'll give you a hint. I'm gonna pick one of two drugs. It's either gonna be Predacetate or Neopolydex. And by a show of hands, who would pick prednisolone acetate? And who would pick Neopolydex? And Laura, why would that be?
You missed the question.
Oh, so it's a red gross eye, and we're talking about, I want to give that eye steroids. I'm gonna put some steroids on that eye, and I've got my two main choices, Predacetate and Neopolydex. And the question is, which would you choose? And the reason why? Indeed, you bet. Look at all that yuck and gunk and whatnot. There's a ton of inflammation here, so you need an anti-inflammatory, and the pred won't probably do anything for this. Now, mind you, is that who knows the difference between a primary infection and secondary infection? Raise your hand. You got, okay. A primary infection is where the infection is the main thing. In other words, an abscess. There's infection there. In this scenario, this debris and whatnot is secondary infection. It's secondary to the inflammation in the eye. Does that make sense?
Mm-hmm. Okay.
So you could look at that eye and say, oh God, it's got a bunch of pus, put antibiotic on it. That's fine. That will treat the secondary portion of the disease, but the primary portion, the real meat of it, is that stuff. That's why the discharge is being produced. So when we look at pictures like this, I mean, this is what we see when we look at the slit lamp, with the slit lamp, and we pick apart all those little details and we try and figure out which is the best drug to use. Everybody get that? What are the side effects of steroids? There's a whole bunch of them. Topical meds, in general, are about half absorbed by the eye only and half absorbed by the rest of the body. So a little teeny bit, when you put it in the eye, does go into the system. Do we care? Most of the time not. Now, a drop size is fairly constant. Every time you squeeze a bottle, of the liquid that comes out is almost always 30 to 35 microliters. It's been studied and that's what it is. And that drop contains a microscopic amount of drug. Now, if you keep doing drop, 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 and you put it in a dog's mouth, you're giving them systemic medication. You see? Now, in general, drops are so small and the amount of drug is so little, you don't really care, unless it's a really small dog or any animal for that matter, because the drops can add up. And the other is diabetics. For those of you who don't know, corticosteroids will interfere with insulin and make diabetes less well controlled. When do we care about that? Mostly when we do cataract surgery on diabetics, because they need the steroids. They absolutely need them in the eye after surgery. So we're balancing. We don't want to make them sick, but we want to make their eye better. Thus, it is possible to cause systemic illness with topical meds. Clients ask that all the time, but only rarely, and really in selected scenarios. In fact, it's usually not difficult to use long-term steroids safely, especially in the eye. We do it all the time, and we can make a scenario where the risk is very low and the benefit is very high. Not necessarily the case with oral steroids. Oral steroids are more challenging if you're going to be using those long-term. Now, the short-term side effects are just annoying, not dangerous, and they include PUPD, PP. Who knows what that means?
Polyuria, polydipsia,
Polyphagia.
Yeah.
So drinking too much, peeing too much, and eating too much. Those are just annoying, except to the client, when the doggy pees all over the carpet and whatnot. So it's good to know this to warn people. Or if they call up and say the dog's peeing all over the place and they just had cataract surgery and they're on QID meds, this is something to think of. The long-term side effects can be nasty. We were talking about immune suppression. That can happen, usually only at high doses, and if that occurs, that's obviously something to avoid. Systemic side effects are way more common with systemic treatment. In fact, I go so far as to say that you almost always get side effects if you're going to use pills. Why do we care? We need to inform the owners, let them know their dogs might become PUPD after cataract surgery, or again, if they call, then we have something to tell them. This is a cartoon showing what happens when you give too much steroids for too long. You cause a disease called Cushing's syndrome. Cushing's disease is a disease where the body produces its own cortisone abnormally. Cushing's syndrome is when we cause it ourselves, when we give cortisone and we cause it. There's muscle wasting, the belly hangs out, they lose hair. Interesting thing is it's the exact opposite of androgenic steroids. Take androgenic steroids to build muscle, and corticosteroids actually break down muscle. Some specific things that matter to us in our business with regards to steroids. Can steroids cause corneal ulcers? Has a client ever asked you guys that?
Can they cause ulcers?
Yeah.
Yeah.
Clients ask me that on a somewhat routine basis, and the truth is, not directly. In any dog, any topical medication can make them rub the eye, period, bottom line. And that's the way it is with steroids too. In cat, it's the same deal. However, kitty cats carry or can carry herpes in their bodies. In fact, studies have shown that about 90% of adult cats carry it in their brain. Now, some cats can carry it in their eye with no symptoms, meaning it's called latent, meaning it's just kind of hanging out, just living there, waiting for whatever. Now, if you dump a bunch of steroids in the eye, you will cause, or you can cause, local immunosuppression, and that can cause herpes to become active. So you'll hear people say cortisone causes herpes. It doesn't cause herpes. Herpes already is. It just makes it easier for herpes to proliferate and be a problem. Same in people. In some people who get oral steroids or whatever, you break out with shingles, and it's a real dragging that happens. Otherwise, steroids are not directly toxic to the eye. Not directly toxic. Prednisolone acetate may be involved in corneal mineralization. You guys have probably all seen the old fart dogs with that white chalky stuff on their eye, which is mineral. And I don't think anybody knows for sure why, but prednisone can exacerbate that, not just in the eye. If you've ever had an intra-articular injection of cortisone for a bad joint, cortisone can cause similar changes in the joint too. So it's not just the eye, it's a general cortisone and ligamentous tissue issue, if that makes sense. How do we deal with that? Well, most dogs with mineralization, if we're going to use cortisone, we don't use pred, but not in every case. Or I might just use a little bit. NPD, as we all know, contains neomycin, polymyxin, and dexamethasone. The first two drugs, neomycin, polymyxin, they're antibiotics, they have potential to be irritating. Not routinely, but they absolutely can, particularly in kitty cats. As a general rule, you guys all know this, steroids should not be used in the presence of a corneal ulcer, with some exceptions, definitely with some exceptions. And how come? Because steroids will slow healing of the ulcer and can lead to immunosuppression and abscessation. So here's a question for you. So a client's treating an ulcer, they're treating it 3 times a day with ofloxacin, and for some reason they screw up and they put 1 drop of neopolidix and they call in a panic. Yes, this has happened. What do you tell them?
Just the one time?
Yeah, just the one time. I just put, oh my God, I put the drop in, what's gonna happen? You guys told me not to do that. You said never do it. What's gonna happen?
As long as it's that one time.
Yeah, it's
It's
cool.
one time,
It doesn't,
yeah.
just because you put a couple drops in the eye, it's not gonna abscess and fall out. But if you keep doing it and doing it, you'll suppress healing, increase the chance of immunosuppression, increase the chance of abscessation. So this is good info to help talk to owners about, when they come up with this sort of thing. This is an example of mild mineralization of the cornea, and this is more severe. In this eye right here, we're going to probably have to diamond burn anyway, so we're not going to bother talking about pred. But that drug I'd be less likely to use in this scenario. So what's the moral of the story? Steroids, like any drugs, have effects and side effects. Getting back to androgenic steroids, one of the effects of androgenic steroids is you get big and strong, and you hit lots of home runs. And if you're Barry Bonds, you get rich and famous. Now on the flip side, if you're Victor Conti, and you get caught of making and selling those drugs, you go to prison. So effect and side effect. It really depends on how you use them, right? So, all right, and as the finale to our lecture today, you realize everybody at Veterinary Vision can be called upon to sing at any time, and that time is now. So if you want to keep rolling the tape, that's all good. I'm not ashamed, because I'm going to teach you guys a song. So there's verses and there's a chorus, and on the chorus you guys are expected to sing. I'll give you a nod, I'll let you know it's your turn, and the chorus is going to happen 3 or 4 times. The first time is, is a pass. You can mumble, I'll help you along so you can get it. The second time you need to sing loud and proud, and the third, I expect harmony. Okay?
Now that's asking a lot right there.
To the tune You Are My Sunshine, which we all know, right? The other night, dear, on my evening walk, I gambled daily, then came to a halt. I closed my OD and yelled out, owie. Then I hung my head and I squawked. Here we go! I need that vision, I need that vision. My eye is really feeling pain. If they could only help me with OD, I will never rub my eyes again. The owner freaked out and then she whipped out her brand new iPhone to make a call. Thank God they're open and now we're hoping it's a simple ulcer and that's all. I need that vision, I need that vision. My eye is really feeling pain. If they could only help me with OD, I will never rub my eyes again.
I got a muzzle.
I got a muzzle and then a subcon and then a big huge cone of shame. My eye is better and a bit more open, but the collar really makes me feel lame. I need that vision, I need that vision. My eye is really feeling pain. If they could only help me with OD, I will never rub my eyes again. Woo! Yay! Woo! Thank you. All right. By the way, I think I lost a bet. I think that's how this all came out.
And we're so very glad.
There we go. All right. Cool. Thank you.
Excellent.
You want me to talk about staffing now?
Yes. Yeah, now.
All right, cool.
Now's a good time, quick, before they run.
Yeah, before they leave. So, as you guys know,